free suture also. Okay, Dr. Buford here. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. There's a blue cannula coming in the front. Remember, you're laying on your side, so your arm's up in the air. So as a result, the glenoid's down below. Let me show you. There's the glenoid. Not much arthritis. That's good. And then the humeral head is up above. This is the back of the joint. There's the humeral head. And then as we look here, the rotator cuff tear is going to be right all in there. Out of the gate, though, we can identify that this biceps tendon is torn. So I'm going to pass a stitch through what's left of it. There's not much. And we'll try and secure this. Hold the camera there. And so in order to do that, we first pass that needle through, and then we take the super shuttle, and then we take a free suture. We've got a special type of stitch that allows us to still kind of get a good hold on a tendon when it's this torn. Okay, so that's the first pass, and now we're going to do the same thing one more time. Move in a slightly different angle. I think rotate down. Yeah, there you go. I think that's it. It's hard to tell because, again, that tendon is almost completely severed already. So we'll go with that. And now we're going to, let me just level you just a little bit like that. There you go. We're going to pass that suture, the shuttle relay again. Okay. And now we're going to go ahead, and this is our little trick here. First we're going to grab the wire just to hold it while we pull the needle out like that. And then the trick is we're going to reach around behind this torn tendon. How's our systolic doing for you? Is she under 100? And now we'll pull it out this way. Pause. Okay, so as we pull tight, you can see how that stitch goes around it. We call that a purse string kind of suture. And where's the pump? And now we're going to go ahead and release the biceps where it's torn right at its insertion here. Okay, and now that we've done that, we get a better idea of what's going on with the rotator cuff tear. Give me a little slack on this. We can smooth out the labrum a little bit. And this is where we're going to be reattaching the rotator cuff right here. Okay, so next step is to go ahead and go up above this tear, which means we'll go off on the video. We'll come back up in just a little bit. Okay, so here's the look from above. We were looking down through the tear in the rotator cuff. This kind of upside down V shape is the torn tendon. We're going to start, though, with a little bit of a decompression, which just means taking off a little bit of bone here. Try and focus this a little better. There we go. Okay, so here we're looking towards the front, and you can see how much bone we're taking off from basically the width of this burr. So we're going to start underneath here and just can you turn my outflow to medium, please? Hold those sutures snug. So we'll get anterior and lateral. And that looks pretty good. Now we've still got this spur underneath your clavicle to deal with. We'll show you some more in a little bit. I know. Go ahead. Okay, so here's the tear. The glenoid's back here. Here's the apex of the tear right about here. We're going to put our first ripstop stitch back here like that. These are also go by many names. It's also called a margin conversion suture. Level up your camera. There you go. Okay, and so now we're going to place a suture right there. Pause. Okay, there's the first one tied. Obviously this tendon's thin, so we're trying to be very gentle with it. Pause. Okay, you can see we've passed and tied 2 side-to-side sutures. We're working on a third. And we're just cruising along here. Things are starting to come together nicely. We stop when there's too much tension, because we don't want to repair this under any extra tension. But that looks pretty good so far. We'll get this tied and show you where we're at. Pause. Okay, so we've got a triple loaded anchor in. We're going to go ahead and start with our suturing in the back, which is over here on the left side of the screen. Go ahead and take the camera. And so with our grasper here, I can hold it, again, trying to be gentle on this very thin tendon, but I can hold it reduced. I can hopefully pass a stitch just like that. That's exactly what I wanted to do. I like that. And there's the relay coming out. Try and show you a little bit better. Okay. Pause. Okay, so we've passed 3 side-to-sides and 2 triple-loaded anchors. We're looking from the back now, and we'll show you why in just a minute. But the cuff itself is repaired, and it looks good. The reason why we're looking from the back is we're going to use this biceps as some extra repair material. And we're going to secure the biceps right up next to the edge of the cuff repair, okay? And so we're going to do that with an anchor. I just want to show you what we're about to do. This will be the last thing we do. Okay, so we're just making some little holes in the bone now, and that just opens up the marrow space. We've got plenty of anchors in there, so the marrow space is going to be plenty open. We're going to turn off the pump now and open up the drain. You'll see some yellow droplets coming out of that little hole we just made. I just wanted to demonstrate that for you. You can just see it starting to happen there as we take all the fluid away. Okay, so good luck to you now. I really hope this does the trick for you. Bye-bye.